What is spina bifida? The term spina bifida means split spine. Spina bifida is usually apparent at birth. Spina bifida happens during the first 28 days of pregnancy, often before a woman knows she's pregnant. The condition is a type of neural tube defect, NTD. Spina bifida is when a baby's spine and spinal cord does not develop properly in the womb, causing a gap in the spine. The neural tube is the structure that eventually develops into the baby's brain and spinal cord. The neural tube starts to form in early pregnancy and closes about 4 weeks after conception. In spina bifida, part of the neural tube does not develop or close properly, leading to defects in the spinal cord and bones of the spine, vertebrae. It's not known what causes spina bifida, but a lack of folic acid before and in the early stages of pregnancy is a significant risk factor. Types of spina bifida. There are several different types of spina bifida, including Spina bifida occulta, the most common and mildest type of spina bifida. One or more vertebrae do not form properly, but the gap in the spine is very small. Spina bifida occulta does not usually cause any problems and most people are unaware they have it. A skin dimple or a tuft of hair at the site of the vertebral defect. Tethered cord syndrome. In this instance the spinal cord becomes attached to the vertebral defect, causing mobility and bladder difficulties. Spina bifida cystica. Spina bifida cystica is characterized by a visible sac on the back over the spine. 2 types of this defect exist. Myelomeningocele, the most severe type of spina bifida. The baby's spinal canal remains open along several vertebrae in the back, allowing the spinal cord and protective membranes around it to push out and form a sac in the baby's back. Meningocele, another serious type of spina bifida where the protective membranes around the spinal cord, meninges, push out through the spine. The spinal cord usually develops normally, so surgery can often be used to remove the membranes without damaging the nerves. Cranium bifida. In the cranium bifida the bones of the skull do not develop fully. This may be characterized by encephalocele, a sac containing connective tissue. Anencephaly, missing brain tissue, the baby may be stillborn or die shortly after birth. Hydrocephalus. Most babies with spina bifida also have hydrocephalus, in which there is excess CSF in the brain. This may cause the head to enlarge, damage to the brain, resulting in learning problems. Spina bifida in adults. Adults who have spina bifida face different problems than do children, including normal aging process including loss of muscle strength and flexibility, less physical stamina, and a decrease in sensory abilities tend to decline faster or more severe for adults with SP. During spinal cord tethering, the spinal cord becomes attached to surrounding tissue. They cause symptoms of skin sores, rapidly progressing scoliosis, loss of sensation, pain, especially in the lower extremities or testicles, and urinary tract infections or leakage. Changes in bowel patterns including constipation or abdominal pain. Orthopedic issues such as osteoporosis, early onset of arthritis, and progressive back pain. Loss of skin sensation as well as poor circulation, inability to sweat, bruising, and slow wound healing. Latex allergy. High blood pressure. Obstructive and central sleep apnea that can lead to long-term damage to the heart. Adults with spina bifida tend to have high rates of obesity. Women with spina bifida are able to get pregnant, however their condition can make pregnancy more complex. Complications of spina bifida. Spina bifida may cause minimal symptoms or minor physical problems, but severe spina bifida can lead to more significant physical conditions. Severity is affected by the size and location of the neural tube defect, whether skin covers the affected area, which spinal nerves come out of the affected area of the spinal cord. This list of possible complications may seem overwhelming, but not all children with spina bifida get all of these complications. Many of these complications can be treated. Walking and mobility problems. The nerves that control the leg muscles don't work properly below the area of the spina bifida defect. This can cause muscle weakness of the legs and sometimes paralysis. Whether a child can walk typically depends on where the defect is, its size, and the care received before and after birth. Orthopedic complications. Children with myelomeningocele can have a variety of problems in the legs and spine because of weak muscles in the legs and back. The types of problems depend on the location of the defect. Possible problems include orthopedic issues such as curved spine, scoliosis, abnormal growth, dislocation of the hip, bone and joint deformities, muscle contractures, bowel and bladder problems. Nerves that supply the bladder and bowels usually don't work properly when children have myelomeningocele. This is because the nerves that supply the bowel and bladder come from the lowest level of the spinal cord. Accumulation of fluid in the brain, hydrocephalus. Babies born with myelomeningocele commonly experience accumulation of fluid in the brain, a condition known as hydrocephalus. Shunt malfunction. Shunts placed in the brain to treat hydrocephalus can stop working or become infected. Warning signs may vary. Some of the warning signs of a shunt that isn't working include headaches, vomiting, sleepiness, irritability, swelling or redness along the shunt, confusion, changes in the eyes, fixed downward gaze, trouble feeding, seizures. Chiari malformation type 2. Chiari malformation type 2 is a common problem with the brain in children who have the myelomeningocele type of spina bifida. The brainstem is the lowest part of the brain above the spinal cord. In Chiari malformation type 2, the brainstem is elongated and positioned lower than usual. This can cause problems with breathing and swallowing. Rarely, compression on this area of the brain occurs and surgery is needed to relieve the pressure. Infection in the tissues surrounding the brain, meningitis. Some babies with myelomeningocele may develop meningitis, an infection in the tissues surrounding the brain. This potentially life-threatening infection may cause brain injury. Tethered spinal cord. Tethered spinal cord results when the spinal nerves bind to the scar where the defect was closed surgically. The spinal cord is less able to grow as the child grows. This progressive tethering can cause loss of muscle function to the legs, bowel or bladder. Surgery can limit the degree of disability. Sleep-disordered breathing. Both children and adults with spina bifida, particularly myelomeningocele, may have sleep apnea or other sleep disorders. Assessment for a sleep disorder in those with myelomeningocele helps detect sleep-disordered breathing, such as sleep apnea, which warrants treatment to improve health and quality of life. Skin problems. Children with spina bifida may get wounds on their feet, legs, buttocks or back. They can't feel when they get a blister or sore. Sores or blisters can turn into deep wounds or foot infections that are hard to treat. Children with myelomeningocele have a higher risk of wound problems and casts. Latex allergy. Children with spina bifida have a higher risk of latex allergy, an allergic reaction to natural rubber or latex products. Latex allergy may cause rash, sneezing, itching, watery eyes and a runny nose. It can also cause anaphylaxis, a potentially life-threatening condition in which swelling of the face and airways can make breathing difficult. So it's best to use latex-free gloves and equipment at delivery time and when caring for a child with spina bifida. Other complications. More problems may arise as children with spina bifida get older, such as urinary tract infections, gastrointestinal, GI, disorders and depression. Children with myelomeningocele may develop learning disorders, such as problems paying attention, and difficulty learning. Symptoms of spina bifida. Most people with spina bifida are able to have surgery to close the opening in the spine. But the nervous system will usually already have been damaged, which can lead to problems such as weakness or total paralysis of the legs, bowel incontinence and urinary incontinence, loss of skin sensation in the legs and around the bottom. The child is unable to feel hot or cold, which can lead to accidental injury. Many babies will have or develop hydrocephalus, a buildup of fluid on the brain, which can further damage the brain. Most people with spina bifida have normal intelligence, but some have learning difficulties. Causes of spina bifida. The cause of spina bifida is unknown, but a number of factors can increase the risk of a baby developing the condition. These include low folic acid intake during pregnancy, Having a family history of spina bifida. Medicines. Taking certain medicines such as valproic acid, used to prevent seizures, during pregnancy has been linked to an increased risk of having a baby with spina bifida. Can spina bifida be prevented before and during pregnancy? Even though there is no known cause, experts believe spina bifida can be avoided with some simple measures to follow. Folic acid, a water-soluble B vitamin often found in leafy green vegetables, plays an important role in the prevention of spina bifida. During years, women should take a vitamin with 400 micrograms, 0.4 milligrams, folic acid every day. Some studies suggest that if women take this dosage of folic acid, the incidence of spina bifida could be reduced by up to 75%. Tell your healthcare provider if you are taking any prescription and over-the-counter drugs, herbal and dietary supplements and vitamins. Treat any fevers immediately with store brand acetaminophen or its brand name Tylenol. Avoid using hot tubs or saunas that overheat your body. If you have diabetes or are obese, be sure to do your best to keep these conditions under control while you're pregnant. Planning pregnancy. Adult women who are planning pregnancy or who could become pregnant should be advised to get 400 to 800 micrograms of folic acid a day. Your body doesn't absorb folate as easily as it absorbs synthetic folic acid. Most people don't get the recommended amount of folate through diet alone. So vitamin supplements are necessary to prevent spina bifida. And it's possible that folic acid will also help reduce the risk of other birth defects, including cleft lip, cleft palate and some congenital heart defects. It's also a good idea to eat a healthy diet, including foods rich in folate or enriched with folic acid. Folic acid. This vitamin is present naturally in many foods, including beans and peas, citrus fruits and juices, egg yolks, milk, avocados, dark green vegetables, such as broccoli and spinach, when higher doses are needed. If you have spina bifida or if you've previously given birth to a child with spina bifida, you'll need extra folic acid before you become pregnant. If you're taking anti-seizure medications or you have diabetes, you may also benefit from a higher dose of this B vitamin. Check with your doctor before taking additional folic acid supplements. Diagnosis of spina bifida. 3 tests can check for spina bifida and other birth defects while the baby is still in the womb. Blood test. A sample of the mother's blood is tested to see if it has a certain protein the baby makes called AFP. If the level of AFP is very high, it could mean the baby has spina bifida or another neural tube defect. Ultrasound. High-frequency sound waves bounce off tissues in your body to make black and white pictures of the baby on a computer monitor. If your baby has spina bifida, you may see an open spine or a sac poking out of the spine. Amniocentesis. If the blood test shows a high level of AFP but the ultrasound looks normal, your doctor may recommend amniocentesis. This is when your doctor uses a needle to take a small amount of fluid from the amniotic sac around the baby. If there's a high level of AFP in that fluid, that means the skin around the baby's sac is missing and AFP has leaked into the amniotic sac. Sometimes, spina bifida is diagnosed after a baby is born, usually if the mother didn't get prenatal care or the ultrasound didn't show anything wrong. The doctor probably will want to get x-rays of the baby's body and do a magnetic resonance imaging (MRI) scan, which uses strong magnets and radio waves to get more detailed images. Spina bifida treatments. Not all people born with spina bifida have the same needs, so treatment will be different for each person. Some people have problems that are more serious than others. People with myelomeningocele and meningocele will need more treatments than people with spina bifida occulta. Causes and prevention. We do not know all of the causes of spina bifida. The role that genetics and the environment play in causing spina bifida needs to be studied further. However, we do know that there are ways for women to reduce the risk of having a baby with spina bifida both before and during her pregnancy. If you are pregnant or could get pregnant, use the following tips to help prevent your baby from having spina bifida. Take 400 micrograms, mg, of folic acid every day. If you have already had a pregnancy affected by spina bifida, you may need to take a higher dose of folic acid before pregnancy and during early pregnancy. Talk to your doctor or pharmacist about any prescription and over-the-counter drugs, vitamins, and dietary or herbal supplements you are taking. If you have a medical condition, such as diabetes or obesity, be sure it is under control before you become pregnant. Avoid overheating your body, as might happen if you use a hot tub or sauna. Treat any fever you have right away with Tylenol or Crocin, or store brand acetaminophen or paracetamol. Remember, spina bifida happens in the first few weeks of pregnancy, often before a woman knows she's pregnant. Although folic acid is not a guarantee that a woman will have a healthy pregnancy, taking folic acid can help reduce a woman's risk of having a pregnancy affected by spina bifida. Because half of all pregnancies in the United States are unplanned, it is important that all women who can become pregnant take 400 micrograms of folic acid daily. Living with spina bifida can range from mild to severe. Some people may have little to no disability. Other people may be limited in the way they move or function. Some people may even be paralyzed or unable to walk or move parts of their body. Even so, with the right care, most people affected by spina bifida lead